My name is Frank Tuffy. I am the business manager for Lakeside Vision in Hawley, Pennsylvania. In that role, I'm not a practice manager. I don't get involved in the nitty gritty of the day-to-day anymore, but I look at the larger picture, taking a look at metrics, how to make the business grow, how to make the business more successful overall. I think the biggest challenge overall, and I'm sure we're not the only one that faced that, this isn't just for the eye care industry, is that there's been a complete shift in mindset to a work from home environment. This is what COVID brought to us, and it's been extremely challenging. And really, for the most part, it's something that cannot be supported by the eye care industry. So you really need to work hard to identify the right team members and look for ways to differentiate yourself from other employers. One thing is we want to make sure that we provide some flexibility for people in their work schedule. We did that by putting together a 4-day work week where we're still able to see the same number of patients. We're still able to provide the same level of care. So people really enjoy that flexibility. They have every Wednesday off. They can set their doctor appointments. They can do all their errands on Wednesdays. Makes it easier for us as well because we don't have people calling in as much because they have those things to do or missing as much time. So that's worked really well. We use assessments to make sure we're identifying the right team members. So we're identifying people who have a healthcare mindset. They have the ability to learn quickly. We also want to be able to, compensate them correctly. So what we've done is put in place a little bit of a profit sharing plan to make these people owners. So it's based on net income. So it's based on the bottom line. So we could have done it on gross. We could have done it on a lot of different things. But at the end of the day, it's net income that makes a difference. It's where the practice sits. So what we did is we put together a model that takes a percentage of net income and divides it amongst all the team members on a monthly basis. So every month there's a bonus. And it's not just based on net income over a certain level, it's based on total. So now staff members understand how what they do brings success to the practice, how their individual task, how they handle a situation with a patient, how that all ties into the bottom line. And at the end of the day, you start to hear these little conversations between people. Well, we don't want to do that. We don't want to spend that. Let's look for a better option. Let's do this. Things that you would have never heard before because it didn't impact them. So now it does. So you make people owners and they start to act like owners, and it makes a big difference. Overall, I'll tell you, 2022 was a great year for us. We've had, I think this is our 4th record year in a row now. So we've been doing really, really well. We consistently fill our schedule, which is great. And we fill our schedule and also find ways to always have room for patients. We're still getting people in for same-day appointments, even though we're seeing potentially 35, 40 patients a day. We try not to turn people away. And quite honestly, our competitors in the area are doing that. If you call into them, they're waiting 2 weeks, 3 weeks, maybe longer for a simple eye exam. So that was one of the things we constantly focus on. One of the things we were real happy with is our capture rate. Our capture rate tends to run in the 75 to 80% range, which is really good. And we've done that a bunch of different ways. We put in some package plans to help that capture rate go up. Still has a good margin for us, but at the end of the day, helps patients it helps the prescription from leaving the practice, which at the end of the day is the main objective. So I think we're really happy with that. And at the same time, we've done all that and we focus on things from a business side. We're still getting really good reviews. We're providing a high level of care for the patients. So all in all, I think 2022 has been pretty successful. Our collection numbers continue to get better year over year. The percentage we collect improves year over year, which is great. And some of that comes from the team we have in place. They're really good at what they do. They work really well together. They understand, as I touched on profit sharing before, they understand what they do. ties into the success of the practice, and that includes collections. So they go into these industry groups, they get into billing groups on Facebook and these other things, and they learn. They're not afraid to ask questions, and our collection numbers continue to improve year on year. And at the end of the day, what do a lot of practitioners worry about? Collections, getting money in the door, cash flow. You have somebody who's really good at doing that, and that goes away. And then the practitioner can focus purely on patient care. I would say the easiest way to look at it is, the practice owners probably mentioned cash flow 3 or 4 times a day 4 years ago. It doesn't get brought up anymore. I think that's the easiest way to measure it. It's not a concern. There's a consistent flow of income coming into the practice. If 2023, our focus is going to continue to do on what we do really well. And if you look at like the Edge Pro rankings and we look at who we are, our capture rate is high. Our collections per exam are very high. We're in the top 3-4% when I look at those numbers. But that being said, we're always looking to identify new options, new technology for patient care, looking at potential expansion if the right opportunity comes along. We know our model could bring quality eye care to some underserved communities. So that's something we're really going to take a focus on. We're going to continue to focus on the key business drivers that we use. So when we look at our numbers, what I've done is probably a little different. So I use the numbers all the time. I look at metrics, I crunch numbers, I look for patterns, I look for ways to improve things. But I don't overlook at them. I don't make rash decisions based on a number moving one way from one day to the other. You have to look at the bigger picture and what's going on. I think the best way that I've found to use metrics is that I identify what numbers are important for the business, and then I make the team members responsible for those numbers. So, and for whatever number is closest to what they do on a daily basis, so they can see the correlation between the tasks they perform, what those numbers are, whether how many widgets you're processing a day or whatever it may be, and then how that ties into the bigger picture. So, I've seen practices where team members don't understand. They're looking at numbers, but they don't understand what the numbers are they're looking at. So they need to be invested in the process to ensure the success of the practice. So we identify the key business drivers, and then I developed a weekly MIS report that uses those key drivers and puts it in a consolidated view that the entire team can see on a daily basis. And then each of those drivers, as I mentioned, is assigned an owner. And on a weekly basis, we can see those numbers and see how we trend week to week. And people could see how they trend week to week on the individual tasks they own. And then, as I mentioned earlier, we put the staff into a profit sharing plan, and they can tie that bigger picture together from beginning to end. Some of them are going to be as simple as recalls, number of friends and family appointments booked, number of new patient exams. But then you're getting into things as simple as, sales numbers, optical sales, and clinical sales. It's nothing complicated. Everything that just ties in to what the people do on a daily basis. And then I can, and if people have questions or everything, we can drill down a little deeper. If I want, my optical team wants to see how they're doing and what their capture rate is, say, just within anti-reflective lenses. I can use the metrics to drill down a little further for them. Not something that I'm going to publish because it tends to be on an individual basis or look at a practice level, but just something that helps people grow or helps me have a conversation with somebody and say, hey, look, you're doing a great job. One thing I've noticed though is, we're not getting any, we're not seeing any progress in AR. Is there anything going on? Is there something a little different in what you're saying? Maybe there's been a change in insurance that I'm not aware of that's not covering something anymore. So it helps us unearth these things to be able to see these numbers and look at those patterns. I mean, to me, the biggest thing is, and you've probably heard me going this direction in the conversation, is the team members need to feel that they're part of the success of the practice. The more engaged they are, the more they feel like there's ownership, the more transparency there is with them, the more engaged they're going to be. And the more engaged they are, they can easily correlate the care they provide patients and the tasks they perform to the overall success of the business. And they see that there's an extra incentive there for them to provide that extra level of care. So I would say the biggest thing is, use the numbers, but share the numbers. Don't be sitting in your office and looking at the numbers and fretting over why one's going this way and one's going the other way. Be transparent with it. Talk to the people. Trust me, they know more than any of us about what's going on a daily basis. So don't be afraid to say you don't know and to ask them the question. And you'd be surprised how much they do know, and how you can work together with them to move the needle, move the numbers the way you want to go.